Hello, this is Sophie Barnes, and I'm going to be talking to you about the performance of accident and emergency departments in 2013-14. First of all, it's important to note that emergency admissions at major A&E departments were at their highest level in nearly a decade during 13-14. Alongside this, the sector is struggling to meet the target to see, treat, admit or discharge 95% of patients within 4 hours. This is despite intense political focus throughout the year and £400 million ploughed into the system to try and combat winter pressures on A&E departments and avoid increased admissions. Just under 3.8 million patients were admitted as an emergency in 2013-14, compared with 2.8 million patients in 04-05 when the data was first collected nationally. This is an increase of 38%. 3.7 million patients were admitted in 12-13, so there has been a 2% increase in the latest year's figures. However, the number of patients attending a Type 1 A&E, a department that is open 24 hours and is led by consultants, actually fell by 0.3% in 13-14 compared with the previous year. This might suggest that while slightly fewer people are turning up at A&Es, the ones who are have more complex conditions that require emergency admissions. While the number of emergency admissions has roughly made up a quarter of attendances over the past decade, this proportion has been steadily increasing, rising from 21% in 04-05 to 27% in the latest year's data. Some experts argue that the increase in emergency admissions could be partly explained by a pressure on trusts to meet the 4-hour target. Some might be admitting people because the clock is approaching the 4-hour deadline and they're concerned about a breach. Several chief executives of trusts have confirmed this is the case sometimes. When it comes to people with complex conditions, they may have in the past taken longer to assess them and then sent them elsewhere, but with the 4-hour target there is more pressure to admit. Winter pressure funding was handed out to all trusts this year. A first tranche of £250 million was given to areas which struggled to meet the 4-hour target the previous year, and a second tranche of £150 million was given to all areas in November. However, several chief executives told HSJ that the money didn't arrive in time for it to make a significant impact. Many trusts had to rely on temporary nurses and consultants to help out in A&Es, and several chief execs said this was a concern because of the variable quality of agency staff. Because of the temporary nature of the funding, it was difficult to implement schemes for reducing admissions that would have a significant impact, and difficult to recruit permanent staff because the funding would not necessarily be available to pay wages later in the year. Despite a considerably milder winter than last year, performance against the 4-hour target at Type 1 A&Es dropped slightly from 93.7% in 2012-13 to 93.5%. HSJ asked every organisation which received winter funding what it was spent on. We found that 65% of respondents invested in extra nurses and consultants in the emergency department, and 47% increased their bed capacity. While admission avoidance schemes out in the community were not as popular, there were still many examples of CCGs and trusts setting up such schemes. 43% set up discharge teams to avoid admissions, and 33% invested in primary care and community teams who carried out home visits. Interestingly, 29% spent part of their funding on either mental health teams or extra mental health staff in the emergency department, suggesting an increase in the number of patients attending A&Es with mental health conditions.